Your warm introduction, and also to Dr. Cottrell and to you for the invitation. And I'm just looking at the chat, at the backgrounds of the people attending the talk today, and such a rich range of experiences and expertise. So I am looking forward to your comments on this presentation. I will share my screen because this is a work in progress. So I am, again, looking for suggestions because we very much are, let me see if I can make this full screen. How does it look to you, Tori? Is it on?
It's still doing as the preview version. If you go to from beginning up there, it should work.
That way. Is that good?
Perfect.
Okay. So this is a paper, again, that we're working on right now on accommodations for people with and without disabilities. And I have co-authored this with two leading scholars on disability, Doug Cruz and Lisa Shore, as well as a few other colleagues at different universities, Flora Hammond, Renee Edwards, and Jen Cohen. So what we are looking at specifically is a large survey of healthcare workers at a university healthcare organization. And one of the reasons, besides the fact that we were able to sample this particular organization, one of the reasons we look at healthcare is because there's this interesting kind of opposing set of incentives among employers. Yes, they provide healthcare and want people to be better off, but they are also subject to short-term profit motives, and that may actually dominate over the interests of healthcare workers. And we are specifically interested in when healthcare workers ask for accommodations because of needs that they have, whether they are getting those accommodations granted by their employer. And because of this, short-term profit motive, it doesn't always make sense for employers from a profit standpoint to grant these accommodations. So we are asking, to what extent do healthcare workers with disabilities enjoy benefits of employer practices to meet their needs in this environment of cost minimization? And we conducted a new survey to address this question, and we also did a number of follow-up interviews. So again, the framework of our study is that the health of a population is largely determined by the capacity of the healthcare system, but many providers themselves, especially in lower level jobs, have disabilities and have needs for accommodations. In fact, among lower level healthcare jobs, more people have disabilities compared to the overall number of employees with disabilities in the US, 5.5% compared to just under 5%. And healthcare workers are also interesting to study because we get such a diverse range of employees by different kinds of demographic characteristics. So what we did in our study, and you are about to hear the results of this study, is we partnered with a very large statewide university-based healthcare system. It will stay anonymous because of the agreement we had with them. And they agreed to let us survey their workers and do some follow-up interviews. And we did survey healthcare workers with and without disabilities. Altogether, just over 1,400 workers took the survey in the middle of 2023. And we took that survey in Qualtrics. And after dropping people who had missing values, we are left with just shy of 1,000 respondents. So the survey questionnaire was based on an earlier survey that Doug and Lisa did on disability, and also with their expertise on organizational behavior. We took a number of scales from there related to job satisfaction, a commitment to the organization, relationships between workers and their supervisors and coworkers, and so on. We did go through the institutional review board procedure at Rutgers to have our study approved. So the survey instrument was approved, as well as our interview questions. And then we worked with collaborators at this healthcare system to notify all workers across the state about the survey and to get their consent to take the survey. As I mentioned a moment ago, we did have 1,405 people click on our link to the survey, but 135 of those people did not answer any questions. And then an additional 277 people answered some questions, but they did not get to the end where we asked questions about their disability status. So that's why we had to drop, unfortunately, was a good number of respondents. So that's what the main reason we ended up with fewer than 1,405 people. We had 993. We did some checks with those people who answered some of the questions, but not all of them. And some robustness checks showed similar results. If we assumed that most of those people did not have disabilities and we kept them in the sample, we had some similar results. We did end up dropping them because it seemed like misleading to just assume they had no disabilities. So we ended up dropping them. In terms of interviews, we did 41 semi-structured interviews, and this was with people who had taken the survey and had agreed that they wanted to be interviewed. A large number of people said they would like to be interviewed because there was a financial incentive to do an interview. And we are still doing an analysis of that interview data. There are people with and without disabilities, and we ask them questions particular to their workplace culture, around disability, around well-being, around mental health, as well as work-life balance. So it really provided a lot more richness in our understanding of how they felt about their overall well-being at this particular healthcare organization. So we recorded all these interviews, transcribed them, and they were coded using an app called NVivo. And we were able to link their interview data with their survey data. Thank you. So that we have all the answers to their survey as well as what they told us in the interviews. So what we did with the survey data and what I'm about to show you is we did a mostly descriptive analysis, simply comparing the averages for people with and without disabilities. And something that came up in our research that some of you may be thinking as well, we decided to distinguish between people who self-reported disabilities on the survey, as well as people who disclosed their disabilities to the employer. So that's two different ways that you can consider, when we say in our data, people with disabilities. Most of our statistics were for people who reported to have a disability on our survey instrument. But we also did some robustness checks looking at the smaller number of people who actually disclosed their disabilities to their employer. The thinking here was that there may be people who have disabilities, especially hidden disabilities, who do not disclose because of stigma or for other reasons that they don't want to. So an employer may be completely unaware that somebody has a disability, and that could affect whether or not accommodations are granted. And then we did some multivariable regression results or regression analysis to see that whether or not accommodations and work from home have a moderating effect on the relationship between disability and work experiences. So that is our strategy for our statistical work. So here you can see our overall sample, close to 1,000 people. Of that total sample that with observations, there were 765 people with no disability as declared in our survey, and 220 people who declared in our survey that they have a disability. And of that 228 people, 117 had disclosed to their employer, and the rest did not disclose, or they said in our survey, it's complicated. That was one of our options in the survey when we asked them, have you disclosed your disability? So we did, for those of you who do have some experience with regressions, we looked at 15 different outcomes that measured work experiences. A number of those are related to different measures of work satisfaction. And then in this regression analysis, we looked at whether or not somebody has a disability, whether or not somebody had an accommodation granted, or if they were able to work from home. And then we interacted disability status with whether or not they were given an accommodation or were able to work from home. And then we had some control variables. So we controlled on gender, age, the number of children at home, race, ethnicity, marital status, education, income, whether or not they work full-time, the length of their tenure at this organization, and whether or not they have a management role. So that is, in a nutshell, the regression model. So what I'd like to spend most of the remaining time for is to show you our simple descriptive results. And what we did here, again, was compare the averages for people with and without disabilities. And then we tested for whether those differences were statistically significant or not, meaning are they likely to have been caused by chance or not? If something is statistically significant, then it has not, then most likely it did not occur by chance. That we have reasonable confidence within a 95% range that the result did not occur by chance. And the first set of sample means I'll show you is that people with disabilities are less likely to have a bachelor's degree or a graduate degree, and they're more likely to be separated, divorced, or widowed. And we also see that people with disabilities have fewer children and lower income on average compared to people without disabilities. And I'll show you those numbers in just a moment. You'll also see from the data I'm about to show you that the most common reported disability was difficulty with concentrating and making decisions. And after that, the most common disability was difficulty with walking or climbing stairs. The first one actually is also the most common side effect of long COVID. And our survey was taken, after COVID. So and I've done some other work on long COVID, and the increase in reported disabilities, especially people reporting difficulties concentrating and making decisions. So some of this could be, some side effects or long-term effects of long COVID. About half of workers have disclosed their impairments to their employers, And 17% of people with disabilities said they're afraid of being stigmatized. So let me show you those numbers. The way that I'm presenting the next few charts is we have the average of people with disabilities in the first column, then the average of people who do not have a disability in the second column, and the final column shows the difference, which would be the people with disabilities, that average minus the average for people without disabilities. And if there are little stars after the difference, that means that that result is statistically significant, or it's not likely to have happened by chance. So you can see here, on average, people with disabilities have fewer children at home. They are more likely to be non-binary. They're far less likely to be married. They are more likely to have just some college, but no degree. And they are less likely to have a professional degree. And they're also less likely to have an income above $75,000. This is a set of averages for people with disabilities, the kinds of disabilities. And you can again see that of the 228 people in our sample with disabilities, 113 of them, or half, had difficulty concentrating or making decisions. These types of disabilities are not mutually exclusive, so people were allowed to choose multiple disabilities. You can also see that a lot of people did respond that they have long-term health impairments, and after difficulty concentrating, the next most common difficulty was with walking or climbing the stairs, about a quarter of the sample. And here we have some questions that were only answered by people who reported that they have disabilities. And we did ask whether or not people had disclosed their disability to their employer. You can see that only about half of people said yes, they had disclosed. Quarter of people said outright no, they had not disclosed at all. And the remaining quarter said it's complicated, or they did not respond to that question. And roughly 15% of our people with disabilities said they've been treated unfairly. They feel isolated, and or they said they faced stigma at work, or they were afraid of facing stigma. I'm open to, if anyone has interruptions or wanted to ask a clarification question, please just jump right in. I can't see everyone on the screen, but feel free to turn on your mic and ask a clarification question if you have any. So the next set of results that I'm going to show you are different outcomes for work experiences. And we have 15 all together. And what you're going to see overall is that people with disabilities have more negative work experiences. And these work experiences cover a number of indicators, including job satisfaction, the intention to leave their jobs, or turnover intention, as we call it. They have a lower sense of belonging or feeling included. They also have worse relationships with management and with their coworkers, and they have more perceptions of bias against people with disabilities. And these findings are consistent with an earlier study that has used a very large nationally representative survey called the General Social Survey. That was for all employees across different occupations, not just healthcare workers. And we found that accommodations those kind of results were similar to results for work from home, except that people with disabilities are more likely to work at least 2 days per week at home after the pandemic, and people with disabilities are more likely to desire more work from home. So let me show you some of these results and talk about what they mean. These are our 15 different indicators of work experiences. So our first indicator was being somewhat or very satisfied in the job before the pandemic, and people with disabilities were less satisfied in their jobs before the pandemic. The next three indicators, there's not much difference between people with and without disabilities. Those three are being currently satisfied in their job, feeling more productive in their jobs, and having job autonomy. Also, the job autonomy was before and during the pandemic. And now we start to see again more differences between people with and without disabilities. People with disabilities are much more likely to say they intended to leave their jobs before the pandemic, and they intend to leave their jobs currently. So this index of turnover intention is much greater for people with disabilities, which is a sign of dissatisfaction. They're not happy and they want to leave their jobs now. They also have less commitment to the organization. And these questions we had about organizational commitment were questions about, how much do you feel like you belong? How much do you feel valued? And how much do you feel like your employer cares about you? People with disabilities were feeling much less like they belonged, or that they, really had a commitment, or their organization felt committed to them. There were some questions we had about organizational citizenship, like how active people were in staying up on their organization's news and other forms of involvement at their organization. And there we saw not much difference between people with and without disabilities. And then we had a number, the rest, 1, 2, 3, 6 indicators about different kinds of measures of, again, satisfaction. And these were uniformly lower for people with disabilities. How well they felt supported by their organization, how open they thought their organization was to people who are different, how positive the climate is for inclusion, how people with disabilities are treated, and then relationships with their managers and relationships with coworkers. These 6 indices that we constructed based on questions in our survey were uniformly lower for people with disabilities compared to people without disabilities. In terms of accommodations, and I'm getting sort of close to the end of the presentation, so I would love to hear in our discussion that we're going to have soon what your experience is with hearing about people's experiences with getting accommodations. And this slide in particular, if people have feedback on whether or not they're surprised by these results, because I think this is probably one of the most interesting slides in the whole presentation. We were surprised by the extent to which people without disabilities have requested accommodations. So it's not just people with disabilities who are asking for accommodations. We found that 56% of people without disabilities have asked for accommodations. Of course, it is higher for people with disabilities, 70%. One of the most common forms of accommodations that people are asking is for changes in their work schedules. that they typically wanted more flexibility in their work schedules. And we found that that's a major issue for people, especially with disabilities, is they want more flexibility. Another common accommodation that people are asking is for changes in communications and information sharing. I had asked Professor Gilbert for some, good examples here. My understanding, and we just asked on the survey, this general category, changes in communications and information sharing. But when I looked up what are some common examples of this, it's largely for people who have impairments with hearing or with seeing, that they, for example, need apps that help with communication for people who do have visual and hearing impairments, or other forms of artificial intelligence to help with that, or even having PDFs of documents be accessible for people who have visual impairments. I'd love to hear more examples, again, for people who have experience here. We didn't see any difference between people with and without disabilities in having their accommodations granted. So let me show you the numbers behind these bullet points. So people with disabilities were more likely to have requested accommodations, 70% versus 56%. But 56% is still high. This is people without a disability. 56% of people had requested accommodations in the past. And then the next set of responses, you can see the types of accommodations that were requested. The most common was a change to the work schedule, followed by a change in communications or information sharing. And for those two in particular, people with disabilities were more likely to make those kind of requests for accommodations. And then we asked, did you make this change in order to accommodate a health condition, impairment, or disability that you may have? And people with disabilities were much more likely to answer yes to that question. And then the final set of results in this category we thought was also very interesting. Only half of people were granted their accommodation. And that was very similar between people with and without disabilities. Just over a quarter of people received an outright no response from their employer that their accommodation was not granted. And another quarter of the sample of people who had asked for accommodations said that their requests were partially granted. So I think that's also an important result. And I was wondering in our discussion if people wanted to comment on why employers may not grant accommodations. In the framework that I had set up, I had argued, well, it could be because of profit maximization in the employer and their incentive to maximize profits, minimize costs, and that could be why they're not granting accommodations. My last result slide before I summarize and move to discussion is that we are doing these multivariable regressions that I showed you the specification for. And this adverse relationship that you saw between disability and these different measures of work experiences, that negative effect on disability, or that negative relationship between having a disability and the experience at work, that's often dissipated or entirely eliminated if someone is granted an accommodation or if they're able to work from home. So that we feel is a very important result from the regression analysis. So people who have been granted an accommodation or people who are able to work from home, they're much more likely to report that they're satisfied with their jobs, and they're less likely to report wanting to leave their jobs. And these other indices that we constructed on organizational commitment, the perceived organizational support, the perceptions of how open the employer is to differences, the climate for inclusion, the perceptions of the treatment of people with disabilities, and then relationships with one's manager. These all are improved if people are granted accommodations and if people are able to work from home. So this is where we are currently doing the research. That's why I framed this title as preliminary regression results. I'm actually working on the write-up of this week. So it's very much research in progress. So in my final slide, I think one of the main policy implications is that we do need more employer policies to provide work from home and other accommodations instead of pigeonholing individuals who have disabilities into traditional workspaces and traditional forms of work and communication. So granting accommodation requests and requests to work from home can indeed improve worker satisfaction, as well as other indicators of work experiences. It can reduce turnover, especially for people with disabilities. So that is all. I'm going to stop the share. And I do hope that people were engaging with the presentation and have some feedback on this research. So I am opening up to comments as well as any questions people have.
Thank you, Dr. Rodgers. I have a question. Would you mind explaining a little bit about how you defined accommodations within the survey? So, did you have a specific definition that you were sharing with individuals, or was accommodations just kind of open to interpretation whenever they were taking the survey?
Yeah. We did have that list of the kinds of accommodations. So I think there were 7 or 8 categories, but they were fairly broad. So something like a change in your work schedule, or like I mentioned to you, a change in the way information is communicated. So there are these broad categories. But other than that, we did not define accommodations.
Okay. The other question I have, and then maybe others have some more. I wondered if you had seen any correlation between individuals who reported having children at home and requesting accommodations with or without disabilities. Because I was trying to wrap my head around, kind of like Brianna said in the chat, she said it's interesting to see that accommodation requests were granted about the same with or without disabilities. I know as a parent myself, a lot of times I'm needing the flexible schedule for my children. So I wondered if you kind of saw any relation between those two things.
Great question. We collected the data on a number of children, and we did not do that yet as part of our analysis, but I think we should. So that is something I'm actually going to jot down. And we're in the process of, as I mentioned, this was done with, sorry, I'm just taking notes here. This survey was done with one particular employer, one organization. We are in the middle of, like, as we speak, literally editing our survey instrument to have it be done at the national level. And we are adding in more questions about care responsibilities, not only for children, but also people who are providing care for family members who are older or who have a disability.
Thank you.
Mm-hmm. Great questions. Thank you.
Anyone else have any other questions? Feel free to unmute or put them in the chat, and I'm happy to read them.
Uh-oh. I hope I didn't bore people with too many statistics.
I don't think so. I think it was very
Yeah. Or
Um,
this, I know this happens sometime on Zoom. People are multitasking and they're doing other things. If you're one of those people who are multitasking, you don't need to admit it, but I would just love to hear what your experiences are with accommodations. You know, if you do work with people who have asked for accommodations, who have been denied them, or what kind of accommodations people are seeking. Um, I would just love to hear, because I understand there are a number of practitioners and professionals on this call. And I would love to hear any experience that you have around accommodations, either for yourself or the people you work with.
yeah, lots of comments in the chat for sure. Well, Celia, did you have a question? Go ahead.
Yes, Dr. Rodgers, I'm Celia. So it is a very interesting research you have done. I just have one question I'm curious about. So we talk about accommodation for people with disabilities. So we seems like it's more beneficial for them to work from home. However, you also mentioned the isolation and inclusion for people with disabilities in the working environment. How can you just balance and also address that concern as well?
You're right. There are some nuances to working from home, and I need to be careful in overgeneralizing about the benefits of work from home. And isolation can indeed be a drawback, true to that cliche, out of sight, out of mind. And that has been called one of the drawbacks of work from home. So I think work from home is not a panacea, and we do need to think carefully and do research around drawbacks of work from home. I know there's a lot of research being done on productivity effects from work from home, not only for people with disabilities, but in general. And there are some mixed results, especially for when you start looking at gender and people with caregiving responsibilities, Professor Gilbert, as you mentioned. So I think that speaks to the importance of looking closely at work from home and some of those nuances. And that's one reason why I think it was yesterday we decided this paper, we're actually going to split it up into probably 3 papers. The interview results will be a separate paper. And we just decided yesterday to split up the analysis of work from home from the analysis of accommodations for reasons, Celia, that you just said, that there, in some ways, there are more drawbacks to work from home. And I think we need to look at those more carefully. So we just decided, again, to look at those and make this analysis, what you just heard, 2 separate papers.
Thank you. It makes a lot of sense.
Mm-hmm.
We have some questions coming into the chat, lots of comments. Karen asked if the survey indicated any recommendation for how to help those with disabilities to be more successful in dealing with stigma that might occur in the workplace.
In any recommend for how we can help to be more successful. I think the main policy or the main recommendation coming out of the survey would be that for employers to recognize that there are quite a few invisible disabilities out there, especially around mental health and cognition, that people are afraid of disclosing. So we can often make assumptions about our employees based on what we see. And I think it's important for employers to know that there is a high rate of people not disclosing their disabilities because of the fear of being stigmatized. And I think that our results show that almost half of our respondents who have a disability did not disclose that disability to their employer. So that's a pretty high rate of non-disclosure to the employer.
Ellie mentioned in the comments, she said, as somebody who's going into the medical field, I'm worried I won't be taken seriously with the accommodations I'm allowed to have. So that kind of serves that point.
Yeah, I think that's a valid concern. And in this environment, and with the stigma, that Ellie and others like Ellie do need to be careful. Yeah.
Anyone else have any questions they want to ask?
I do want to say, sorry, I'm on the wrong screen, so you can't even see my face. I do want to say that I currently work with children who have serious emotional disorders, and what we are doing with them is the transition to adulthood and what that looks like and how to communicate their concerns with their employers as we move along. I think with what we're doing with the children in the state and with what we're doing with what you're doing, the amazing work that you're doing, I think in combination, we're going to see some improvements along the way. I hope anyway, because I do have my own set of issues. I have seizures, so I have the luxury of being able to work from home, but I still have this miraculous job of being able to work with children with serious emotional disorders. So I just wanted to add that I love the work that you're doing, and I think in combination with what we're doing with our children and what you're doing with the adults, that in the future, we're going to see better results.
Great, thank you. I'm glad you're optimistic. And you remind me of another, I think, important recommendation that comes out of this research, as well as other research that I'm doing. DSPs, or direct service professionals, who are working with individuals with developmental and intellectual disabilities, are often very low paid and often have disabilities themselves. So I think another implication that comes out of this research, as well as some others that we've done, we were seeing this in our interviews as well, was the low pay that some of these healthcare professionals are getting. So as employers, if somebody is coming forward and saying, I can't make ends meet, I really need a raise or a promotion into a higher paying position, to take those kind of requests seriously, because many healthcare professionals working with individuals who have disabilities are facing housing insecurity, food insecurity. So pay is a big issue.
And with that being said, everybody has a superpower. Everybody has a superpower, including our disabled workers out there, our children out there. Everybody has a superpower. And so if these employers are willing to find that superpower for that individual, they can make it work and they can pay them.
Mm-hmm. I agree. Thank you. Any other comments? Or maybe I'll read this last one in the chat. I work with the Department of Human Services, and we ended remote work at the beginning of April. After returning to the workplace on a daily basis, I found that my productivity declined slightly due to more distractions in the workplace. I have a little emoji thing that's preventing me from not seeing I guess the state did allow workers to apply through HR to work from home, but the paperwork had to be completed by a medical professional as well. In my experience, this process deterred those who needed accommodations from advocating for themselves. Yes, just the bureaucracy and the hurdles, I think, can be huge, as well as messaging from employers that working from home is not okay. Yeah. And those distractions, can be detrimental, for some folks who have impairments, and distractions in the workplace can really affect productivity. Thank you, Cheyenne, for sharing that.
Yeah, go ahead.
Gretchen.
Hi, and thank you so much for your presentation. I just have a quick question. If there is a goal for any of this information to be shared amongst the disability policymakers at the state and federal level, just because there's such a high expectation of just because you have a disability, you should still be able to work too. And there is absolutely, that's definitely a goal, I would think, for most people. I'm a person with disabilities myself, but just as this discussion has been basically speaking to, is the difficulties involved in finding, number one, something that is going to work with the schedule of medical necessity and appointments and impairments, and that somebody is going to be willing to allow you the privilege of going to work, and then also just the wages involved, whether or not that's even sometimes worth it, on it, to be perfectly honest. So I'm just curious about the future applications of this wonderful information, and thank you.
Future applications. Well, this research is part of a Center on Disability Studies that we have at Rutgers University, similar to West Virginia University, also up at Syracuse. And these research centers, which are grant funded, are doing a number of studies on employer practices and policies, as well as national practices and policies, to try to have more interventions to improve the lives of people with disabilities. So this paper is just a small part of these efforts at our mutual universities to try to have evidence-informed changes to policy. And I think this paper in particular is looking at employer policies and practices, and to try to convince employers that granting accommodations can make sense because their workers will be happier, they'll probably be more productive, and they'll have lower turnover. And turnover can be very expensive for employers. Any other questions or comments? No?
I don't see any or hear any. Thank you so much, Dr. Rodgers, for this presentation and sharing the information that you're working on. We really appreciate it. I'm also going to, again, make sure that you guys finish the survey, and we'll make sure to share the results with Dr. Rodgers as well to give her some feedback. And if you guys have any other questions, again, feel free to pop them in the chat. I'll hang out for a couple more minutes. And I'm happy to relay those questions to Dr. Rodgers if you're unable to share those in the chat right now. I can certainly share that information. And again, thank you so much, Dr. Rodgers. We really appreciate your time.
Okay, thank you. And thanks to each of you. Thank you, especially Professor Gilbert, for your comments and those of the people in today's session.
Absolutely.
Okay, bye.
Thanks, everyone.